Representative Zelinsakar, welcome to the committee. I will move that House File 500 be re-referred to the Committee on Labor and Economic Development, Finance and Policy. And there is a DE2 amendment. Representative Zelinsakar to the DE2 amendment.
Thank you, Chair Schumacher and members. The DE2 amendment is an amendment that simply prohibits the standard that was created by the Nursing Home Standards Board. It prohibits it from going into effect unless the cost of the standard to each nursing home is estimated and paid in full by the legislative body. That is the amendment.
Thank you. And Representative Zelinsakar, and this is an author's amendment. So I will again move adoption of the DE2 amendment. All those in favor of the DE2 amendment signify by saying aye. Aye. Opposed, say nay. The DE2 is adopted. Representative Zelinsakar, to your bill.
Thank you, Chair Schumacher and members. I'm here today to present House File 500, and as most of you know, I am a retired nursing home administrator. I worked with seniors for over 40 years. I slept on the floor of the assisted livings during the pandemic. I worked as a CNA. I worked side by side with the staff. There probably wasn't a role any of us didn't play. When I tell you I've done it all, and that I know how meaningful and how hard this work is in these 24-hour settings, it's because I've lived it. You've heard testimony today from Chair Schumacher and Rep. Noor's bill to bring critical funding to nursing homes in Minnesota and assisted living facilities, and I look forward to supporting that legislation this year. I view House File 500 as amended as an insurance policy for the state of Minnesota, for seniors, and for this legislative body. Mandates without money have serious consequences. I'm bringing it forward because the governor is proposing to cut Minnesota nursing homes. I'm bringing it forward because an unelected board has finalized 2 rules that are going to greatly harm Minnesota seniors. I'm bringing it forward because the board has refused to listen to the concerns of the provider community about the millions in unfunded costs. It's got misuse and it had an expedited rulemaking, and because the legislator should not ever abdicate its responsibility to assure care for seniors in the 300+ remaining nursing homes we have in the state. With the amendment, House File 500 ensures that the spending authority and the oversight of the budget remains with the 201 members of the legislative body that was elected to serve Minnesotans, not a 9-person board appointed by the governor. I'm very supportive of nursing homes. I fought hard last session to make sure that we addressed it after a pandemic. These nursing homes are coming out of a serious pandemic. I worked as a CNA and a nursing home administrator for 40 years. So when I speak about the impact it's going to have on the state, it's because it's real. And I will continue to fight for high wages like we've been doing for decades, and that funding source comes from this body. I'd like to now turn it over to my testifiers to speak on more specifics of this bill. Thank you, Chair.
Thank you, Representative Zelinsakar. Welcome to the committee. Please state your name for the record and present your testimony.
Mr. Chair and members of the committee, my name is Paxton Whiffler, and I'm the Chief Operating Officer of Monarch Healthcare. We have the privilege to serve 2,900 nursing home residents a day in many parts of Minnesota, including Representative Zelinker's district, the Shores, and 2 Harbors. The types of residents we care for range from simply the shelter challenge to the most clinically complex, ventilator-dependent patients, and really everything in between. I'm here today in support of House File 500, which is really a common sense approach to addressing the high upfront costs that are created by the mandates imposed by the Nursing Home Workforce Standards Board. We have closely monitored the board's actions as they considered the development of the 2 standards mentioned earlier today. I was deeply concerned when the holiday pay requirement was announced, providing us really only 3 weeks to prepare. This mandate alone will cost our facilities approximately $1 million this year, creating a significant financial burden for our organization. The proposed minimum wage standards present even greater concerns as it would significantly increase our costs. You've already heard this, but I want to reiterate it again. As the long-term care imperative estimates, these mandates will cost facilities across all of Minnesota in excess of $200 million. As the nursing home providers operating under Minnesota's rate equalization policy, we have no mechanisms to offset these unfunded mandate increases unless the state provides additional funding. We all want to increase caregiver wages, but the board's approach, along with the governor's budget proposal, has failed to consider the financial viability of nursing facilities and the potential impact on access to care if these mandates remain unfunded. For these reasons, I strongly support House File 500, which clarifies that these mandates must be funded by the state. Thank you, Mr. Chair and members of the committee.
Thank you. Representative Zelenska. Anyone else for your bill presentation? Welcome to the committee, Ms. Hubert. Please introduce yourself for the record and present your testimony.
Thank you, Mr. Chair, members of the committee. For the record, my name is Erin Hubert, and I'm with Leading Age Minnesota here on behalf of the Long-Term Care Imperative. And I would like to thank Representative Zeleznikar for offering House File 500. The imperative supports the bill as amended. And as people have said, it's pretty straightforward. The proposal would ensure that the legislature fully funds the mandates of the Nursing Home Workforce Standards Board or puts those requirements on pause until that happens. I want to highlight a few examples of how these ill-conceived standards will impact Minnesota. The only care center in all of Cook County estimates that the cost of the minimum wage mandate will be about $1.4 million between 2026 and 2027. That community may need to double its local tax levy to maintain operations. And by the way, the next closest non-VA nursing home is over 80 miles away. A metro provider estimates nearly $500,000 in annual expense just to comply with the holiday pay mandate. There is written testimony in your packets from a care center in New Ulm that estimates it will need to either drain its reserves or take out a loan to cover the $723,000 in annual costs for the mandates. Concerns like these were raised by the 3 employer representatives of the board, nursing homes, and the long-term care imperative to no avail. In fact, the 3 employer members of that board had their motives impugned and their concerns entirely dismissed. The last 18 months have made it very clear, unless the legislature takes action this year, the Nursing Home Workforce Standards Board will continue to ignore community providers, minimize the impact that its actions have on access to care, and weaponize its expedited rulemaking authority. We fully support raising wages for caregivers, as you have heard in the previous proposal, and as you have heard long-term care imperative come forward year after year to do. We need reliable funding to offer those competitive wages and ensure that seniors have access to care. We would urge the legislature to either fund those mandates or render them ineffective until they can be paid for. Thank you for the opportunity to testify today.
Thank you, Ms. Hubert. Representative Zelenska. Anyone else for the bill presentation?
Yes.
Welcome to the committee, Mr. Berndt. Please introduce yourself for the record and present your testimony.
Thank you, Mr. Chair, members of the committee. I will try to keep this brief. My name is Kyle Berndt. I'm here today on behalf of the Long-Term Care Imperative to express our support for House File 500. This proposal is critical as we assess the current state of Minnesota's nursing facilities. Coming out of a pandemic that placed unprecedented strain on the industry, we agree that caregivers deserve a raise. However, these unfunded mandates would hurt access to nursing home care in Minnesota. As you heard earlier, it is unfair to require nursing homes to take on additional debt to comply with mandates set by a board that has not been responsive to their concerns. The employer minority report, which we have requested to be included in your packets, highlights several key issues, including the inadequacy of the fiscal analysis conducted by the board of the minimum wage standard, which is updated as part of the amendment at how they would do that fiscal analysis, the absence of a statement of need and reasonableness, and no additional public hearings after over 50 public comments were requested one. You've heard enough about the costs, the $200 million, but the governor's budget provides only $15 million. That's less than 10% of the actual cost of nursing homes. We simply ask legislators to pay for the board's actions or render them ineffective So we ask for your support of House File 500 as amended. Thank you, Mr. Chair and members.
Thank you, Mr. Burnt. Representative Zalinsakar, anyone else on the presentation of your bill?
Chair Schumacher, no.
Okay, then we will move to public testimony and go down the, as it's listed in the agenda, starting with Teresa Bates with SEIU Healthcare. And members, we have about 20 minutes left. We do intend to vote on this today. We'll ask the testifiers to keep to between 2 and 3 minutes, and we'll get through it. Welcome to the committee. Please state your name for the record and present your testimony.
Chair Schumacher and members of the committee, my name is Teresa Brees. I do laundry at a nursing home in Roseville and am a member of SEIU Healthcare Minnesota and Iowa. I'm here to speak in opposition to House File 500, which would get rid of the Nursing Home Workforce Standards Board. Let me start with authors delete everything amendment. Thank you, Representative Zalinsakar. I hope I got that right. And members of the committee for moving away from a full repeal of the Standards Board. We appreciate a step in the right direction. I will let Brian Elliott from SEIU State Council talk about our remaining concerns with the new funding proposal. I want to talk about why the board, the paid holiday rule, and the minimum wage rule are so important to me and my coworkers. I have worked in long-term care for over 25 years and have seen the short staffing damage short staffing causes. I testified in favor of this board in 2023 and shared the story of the time that year I worked 23 straight days because we were so short-staffed. Eventually, I tore my bicep tendon and was barely able to lift my arm. I've struggled with this injury ever since. I saw the low pay and lack of benefits and how that caused so many people to leave despite wanting to work, to do this work. We just aren't treated with the respect we deserve. I was part of the largest nursing home strike in Minnesota history last March because so many of us were fed up. The status quo, where so much money goes to the homes and workers struggle to get by, is bad for us workers, but also bad for our residents. I testified many times in favor of this board because I think bringing together workers, employers, and experts is what we need to address this crisis. I was excited the board spent so much time listening to people across the state and decided that raising wages and offering time and a half holiday pay as first steps. It's amazing how many people have already got paid holidays on Martin Luther King and President's Day who previously didn't get anything extra. And the wage increases are going to be incredibly helpful. In my eyes, as a nursing home worker, this board is doing amazing to address the staffing crisis we all know is a problem for Minnesotans. I was very surprised to hear that this bill to get rid of the board, I've told people I actually think more jobs should have a board like this. I'm sure employers don't like not having total power anymore, but clearly their way wasn't working. I ask you to vote no on this bill and would encourage you to find ways we can all work together to raise standards for all nursing home workers. I hope the amendment is the start of such a conversation. Thank you.
Thank you, Ms. Bates, for your testimony today. Next is Brian Elliott, SEIU Minnesota State Council.
Hi.
Welcome to the committee. Thank you. Please state your name for the record. Yes, the chair does that.
It's the chair.
It is the chair, thank you.
Just a way to ease you in. Please state your name for the record and present your testimony.
You know, what a way to start. My name is Brian Elliott. Good morning, Mr. Chair and members of the committee. I'm the Executive Director of the Service Employees International Union Minnesota State Council. SEIU represents nearly 70,000 essential workers across Minnesota who provide care and support for families in a variety of settings, from individual homes to schools to hospitals in the state's largest commercial buildings, and including thousands of dedicated workers in nursing homes. As one of the lead advocates for the creation of the Nursing Home Workforce Standards Board, I imagine it's no surprise that I'm here today in opposition to the proposed repeal of the board. I now know that given the delete all, I'll speak to that. But quickly, let me just say some standards boards have been in place around this country for almost 100 years, and the idea is pretty straightforward. How can workers, employers, and other industry stakeholders, like the relevant regulatory state agencies in this case, come together to solve the biggest problems facing an industry? In this case, the problem we all face is a significant workforce shortage in skilled nursing facilities. And who better to involve in solving this problem than the very workers already committed to the important work of caring for our seniors every day? The same workers we need to retain and who best understand why they came into the industry as well as why others may not. The key, however, is coming together to work collaboratively. I attended nearly all of the board meetings, a number of its work group meetings, and I can tell you that what I saw was a very cordial environment with respect for each other's opinions. I heard agreement in wanting to support our essential nursing home workers. In fact, that was the reason given by the industry representatives for abstaining rather than voting against the rules promulgated by the board. They wanted to support their workers, but needed to focus more on funding for the industry. What I noticed, however, was that this focus on funding, which of course rests with all of you here at the legislature and not with the board, seems to have interfered with the ability of the industry representatives to focus on the issues under the jurisdiction of the board, to the detriment of the collaboration that we really need to solve the workforce crisis. And this isn't surprising to those of us in the representing workers in this industry. We've repeatedly offered to work together to advocate jointly for a solution to the funding issues raised by the industry, but not in the absence of the accountability needed to ensure that resources are actually addressing the workforce shortage. In conclusion, now given that, I think the DE2 is a step in the right direction. Unfortunately, we still cannot support the bill as amended. This is because we know that wages and benefits have not kept pace with nursing home rate increases over the last decade. We know that the bill as amended will have the effect of punishing operators who've been doing the right thing while rewarding operators who've been chronically underinvesting in their workforce. And we know that this fails to account for natural wage growth, as the original Standards Board legislation does, demanding upfront funding of wage increases that in some of which would have happened anyway, rather than just the additional wage growth attributable to the minimum wage rule. And while we would agree that the current funding system is imperfect, we know that the board rules are not unfunded. And this is important. They are not unfunded. They are rather fully funded, just not on a timeline that the industry prefers. That is the idea behind the values-based reimbursement program. I'll, of course, stick around. We'd be happy to answer any questions. Thank you so much for your time today, and thank you to the author.
Thank you.
Thank you, Mr. Elliott, for your testimony. Sorry for the furniture. We have Vicki Naige, the local president. And after that will be Paxton Whiffler. Welcome to the committee. Please correct your name for me and for the
Yes.
record, and present your testimony.
Okay, well, thank you, Chair, and thank you, committee. I'm Vicki Carnegie. I'm from Worthington, Minnesota. I am an LPN at South Shore Care Center. We used to be a facility of 2 different nursing homes, and after the pandemic, we ended up having one facility close, and we had to merge into one large facility, and that was due to lack of workers and keeping our staff. This bill really has helped us. The committee has made our conditions safer, and with the wages and stuff and the insurance, or sorry, the wages and the holiday pay has also been a great benefit for our workers. We've actually seen more people coming into our facility and applying for jobs and staying. With the training, that is really important. We never really had that before. So they just didn't keep up on our training as well. And it's really nice that we now have that training so that our workers feel better in their jobs and are more, and are more ability, or more able to stay there. So, let's see, sorry. As an LPN, I do work in the nursing home, and I know there are a lot of problems to fix. And, but I do feel we're going in the right direction, and all of our workers do feel the same way. With our retention problem, I know pay increases and benefits are very important to keep our staff. We want quality staff. Quality staff to keep our residents. Our residents are the most important thing to us, and it has always been that way, and that's who we want to be there for them. So I'm kind of opposed to this just because of the funding, but we are definitely going in the right direction, and I hope that we continue to do that. So thank you for your time.
Ms. Carnegie, thank you for your testimony and for making the trip from Worthington.
Thank you. Thank you. Oh, thank you so
For
much.
this. Next is Paxton Whiffler, Monarch Healthcare Management. Never mind. Next, actually, is Taya Gargano, Ask Me Local 1851.
Hello. It's Taya Gargano. But thank you, Chairman Schomacher and members of the committee. I am here in opposition of the HF500 bill or amendment. I work at Elder Care in Bemidji. I have worked there for 6 years. I worked there as a CNA, and now I work as an LPN there. I like having this board. I think that it has helped us, especially in the last couple of years. We do have more consistency in staffing. It gives us, with the benefits and stuff, it makes working at a nursing home more desirable, which to a lot of people, it isn't a super desirable job. I personally like it. I value the elderly people. I value the safety board for valuing our safety. I think it is a good thing. But yeah, I guess that's really all I have to say, I suppose. But I think it's a good thing to have, and we should keep it. Thank you, everybody.
Thank you, Ms.
Yes,
Gargano, for your
thank you.
testimony
Yes,
today.
Thank you.
Finally on the list, Jerry Miller, President of Ask Me 65 Local 1851. Welcome to the committee.
Hi.
If you could please state your name for the record and present your testimony.
Hi, my name is Jerry Miller. Thank you, Chair Schumacher and committee. I am a certified nursing assistant in Bemidji and president of our local 1851. And I'm here today to oppose HF500. I have worked in the nursing home as a CNA for 33 years. I help our residents do their daily tasks, the dressing, the bathing, monitoring vitals, the coordinating their care, ensuring nutrition. A lot of our residents take 2 people to move or do a lot of stuff with. And if you don't have the staff, you are looking at higher injuries for us. We need to keep the help. We help our community, our loved ones, to age with dignity. We love our jobs, but often we are overworked and underpaid. It is a challenge to recruit the new CNAs to come into this line of work. Our residents become part of our family, so it makes it very difficult when we're working short and we just can't give them the care they need. During my tenure, I've seen us go through some rough times. Short staffing, hard to do your job safely. We've had mandatory stayovers because of insufficient funds. As you might work 8 to 10 days in a pay period, in the 2 weeks. And if you worked 8, 7 of those days, you maybe were doing a 16-hour shift just to cover the floor. And that was even before the pandemic. So the wages, I get where it is for an expense for the homes, but we have to also be able to provide for our families and to do the job. It is expensive to try to get more staff in. We had to deal with traveling staff. And then your training and having to still pick up an awful lot of slack for them not knowing our facility, our residents. So we were worried a lot of times about being able to stay open, if we could get through that. And that was well before COVID, like I said. So the Nursing Home Workforce Board, Standard Board legislation that passed in '23 has been important to us. It gives us a seat at the table and has given us the tools we need to retain our staff. With the steps like the industry-wide minimum wage and time and a half for holidays, which is big because we do not close. So other people can have a holiday off, we don't. So we've seen a lot of improvements in the recruiting and the morale. It helps us make sure things are in place to train staff and ensure we can do our job safely. I thank Representative Zollinger for introducing her amendment, but I'm still concerned about how it will affect the goals of the Nursing Home Workforce Standards Boards. I respectfully ask that you oppose HF500.
Thank you, Ms. Miller, for your testimony. Is there anyone else in the public who wishes to testify? Seeing no one, public testimony is closed. We have Representatives Fisher, Bomani, Hiltsley, and Vernig on the list for questions. Representative Fisher.
Thank you, Mr. Chair. I first of all oppose the bill that we've got coming out here because I think it's missing the mark. And the reason I say that, by the information I have found since 2014, the average pay for people who work in nursing homes has gone up by less than 50%. But during that same time frame, the reimbursement rates to the nursing homes have gone up by over 100%. We used to be in 2014 21st in the country of what we paid for nursing homes. Today, we are number 5, so we're 5th most expensive in the country. We've gone from 21 to up to 5th. And so what I'm saying is, I think the dollars in a lot of areas are out there. I'm not denying that there are some nursing homes that may be struggling, but the thing that's a tell to me of what's happening in the industry is, back when I first started in 2013, almost 90% of the nursing homes were nonprofit. Today, the large share of nursing homes are for-profit. So I think we need to take a deeper look as to what's happening out there and where the dollars are really going, because the increases we've put out there, we've more than doubled the pay. It's not going to the workers, and we need to make sure it's going to the workers.
Thank you, Representative Fisher. Representative Bomani, Hiltsley.
Thank you so much, Chair. Thank you so much, Representative Zelenska. I know that we've had many conversations around this topic, and I so appreciate your experience in bringing your voice to this conversation. With that said, as a former SEIU member and as a CNA, a former CNA, I have felt the exhaustion of being overworked, the frustration of not having enough staff to provide the care for the residents they deserve, and the heartbreak of knowing that no matter how much I cared, I was being overstretched beyond my limits. I didn't leave because I wanted to or because I didn't care. I left because I had no choice. So I know that this struggle, because I've lived it. Now, as a legislator and on the House Human Services Committee, I refuse to stand by while nursing home workers continue to be pushed beyond their breaking point. When we fail to protect those who provide care, we fail the residents who depend on them. Understaffing means grandmothers, grandparents, and all that we care for waiting too long for help, and a disabled person missing critical care, and a resident suffering alone because workers simply don't have enough hands. That's why I oppose HF500. This bill does not do enough to prioritize the needs of the frontline workers who are the backbone of the quality care that we pride ourselves in. Safe staffing, fair wages, and real worker protections aren't just optional, they are essential. If we don't care, more workers will leave and more residents will suffer. To my colleagues, we have a choice. We can either fight for the people who dedicate their lives to care for the loved ones, or we can watch the system collapse under a weight of inaction. I choose to fight. I urge you to stand with me and oppose HF 500 because our workers, our residents deserve better. Thank you.
Thank you, Representative Romani Hiltsley. Representative Vernick.
Thank you, Mr. Chair. I did work in a nursing home for quite a few years where the holiday pay was paid at time and a half, so I thought that was a standard practice. This is interesting. I appreciate that the board has put that in place. I also went on to inspect hundreds of nursing homes in the state as a OSHA investigator and compliance officer, and that work resulted in safe patient handling standards. Having a board like this helps establish a floor for worker safety. As we've heard, there is a major discrepancy between management and labor, and this board gives voice to those often left behind. So because of that, I have a really hard time supporting the abolition of the Nursing Home Workforce Standards Board.
Thank you, Representative Vernick. Representative Knorr.
Thank you, Mr. Chair. It's good to see you again in Human Services, Representative Zalesnika. But this bill is not yet ready for action, so I request a roll call, Mr. Chair.
Roll call having been requested, there will be a roll call. Seeing no further discussion, the Committee Legislative Assistant will take the roll.
Chair Schumacher,
Schumacher, aye.
Vice Chair Gilman,
Gilman, aye.
Representative Knorr,
Newt, no.
Representative Keeler,
Healer, no.
Representative Backer,
Backer, aye.
Representative Curran,
No.
Representative Fisher,
Fisher, no.
Representative Franson,
Branson, yes.
Representative Frederick,
Frederick, no.
Representative Gander,
Again, Representative Gander.
Gander, aye.
Gander votes aye.
Representative Gordon,
Gordon, aye.
Representative Momani Hiltsley,
Momani Hiltsley, no.
Representative Jacob, Representative Knutson,
Knutson, aye.
Representative Murphy,
Murphy, aye.
Representative Norris.
No.
And Representative Hicks is excused. There being 9 ayes and 7 nays, House File 500 as amended is re-referred to the Committee on Labor, on Workforce, Labor, and Economic Development, Finance, and Policy.